Hello, my name is Mercedes, and this is my oral presentation for my ethics class, and my instructor is Mr. Carter. In this presentation, I will be talking about a section that we went over this semester, which is about fetal care therapy, which is defined as a continued provision of medical care when there is no reasonable hope. Usually treatments are refused based on the quality of life of the patient, and also doctors have the final say over patients who have expressed a desire to die. One of the examples of fetal care therapy that we went over is when there was a mother in England who filed a lawsuit against a hospital and a doctor because he told her that her unborn child was brain dead and that he would be born with one eye and also have no chance of survival. And the way that the doctor went about telling her this is by a 24-week ultrasound, and she was given medicine to make her have an abortion. And whenever she gave birth to the child, he was actually premature, of course, but he was healthy. He had both eyes, and due to being born early, of course, he was premature, and he has a few lung problems going on, and also he has a cyst on the brain. Now, my question to you is, why do you think that this occurred? In my opinion, I feel like this situation occurred due to malpractice on the doctor's part, and also, if this were to happen today, I feel as if usually if a doctor thinks that there's something wrong with an unborn child, they'll get a second opinion and run more tests instead of just saying, hey, I think you need an abortion, your child's going to have just one eye. Like, how could you find out all of this just from an ultrasound? I just don't understand why someone would put matters in your own hands and just tell a mother, you need to have an abortion due to this, that, and the other, and not have a repeat scan or more tests done. So with all that being said, I would say with the whole fetal care therapy, I don't agree with letting doctors have say-so over everything and every decision. Just like in this case, this mother should have had a say-so over what she wanted. And more than anything, I'm glad that the child came out healthy, even though he does have a few problems. Basically, what resulted from this matter, the mother gave birth to a premature, healthy son who had lung problems and a cyst on the brain, and obviously she sued the hospital and the doctor. I don't blame her for that, and hopefully this story gives justice to her as well as her son and helps someone else, down the road. So, all in all, like I said, I disagree with the whole care therapy, and this is my presentation, like I said, on fetal care therapy, which is a topic that we discussed this semester, and I hope that you learned a lot from my presentation, and thank you for watching.